Welcome back to the Beard Bros podcast. Hope you guys are having a blessed day. We got two nurses that work at Eastern New Mexico Medical Center. We'd like to introduce our guests.
I'm Heather.
My name's Courtney.
Nice.
And we're both nurses at LMD at Eastern.
Nice. How long have you guys been working there?
I've been there for 3 years.
2 years.
2 years? And did you guys go to school for that?
Yes.
How was that?
Hard.
The worst 2 years of my life.
Really? You want to elaborate? Did y'all go? No, she's been at 3, so y'all went at the same.
Yeah, I was the first year when she was the second year.
Mm-hmm.
Okay. How is it?
The prereqs, like the first 2 years, isn't bad at all. And then the first year of nursing school isn't horrible. But the second year of nursing school is pretty bad. Your final
It's
year.
just a lot.
A lot
Okay.
of
Like the questions they
information,
ask are nothing like you've ever seen before.
A lot of clinicals. Yeah.
Is it like a full-time job?
Oh yeah.
Much.
Yeah.
Yeah.
Had you, prior to going to school for that, was that what you wanted to do, like coming out of high school, or was
Yes.
it? Yeah. And so,
What influenced that? Like, what made you want to become nurses?
I didn't. Since I was 9, I wanted to be a baby nurse. So I don't
Yeah,
know
I've
really
just always
why.
wanted to be a labor and delivery nurse.
Yeah.
Is that what you learned?
Yeah.
Okay.
nice. And so, what was one of the most challenging things that you guys experienced just during the school?
I think it takes a toll on your mental health.
It really
Honestly.
does. In your marriage, there's a lot of people who get a divorce while they're in
In
nursing
nursing
school.
Oh, really?
Yeah.
Gain a lot of weight during nursing
Oh yeah, I
school.
gained 30 pounds.
Oh man.
It's hard.
Please
If you don't mind, what year did you graduate high school?
2008.
2012.
Okay, you're super younger.
Thank you.
Well, no, I graduated right along with you,
Okay.
so we're good. We're good. And so, once you finished school, did you think you'd be here, or did you want to go somewhere else, or did it matter?
No, I wanted to go here.
You
I
did?
knew that Eastern had a really good program, so
Okay,
yeah.
and that's what I've heard is Eastern has a really good nursing
It's
school.
the number one in the state.
Really
Yeah.
nice. So that's you gotta feel
Yeah.
pretty honored.
Yeah.
Like,
Is it
accomplished.
hard to get in there since it's
Yes.
the number one?
It's pretty hard. And you lose a lot of people along the way.
Yeah.
I
You'll
think
start with
I started with 48 and
Yeah.
like 12 of us graduated together.
Wow.
the
So it's like
first
high
year
school?
it gets cut in
It's
half.
like high school, basically, you just lose them at the end.
Well, that's a what? That's a quarter of the attendance
Yeah.
already.
Mhm.
So that's
Damn.
and it is a 2-year program, right?
The actual nursing program is 2 years.
And then what do? You said clinicals afterwards
During
during.
Time, yeah.
Oh
both
man.
years.
Yeah.
And how's that work?
So first year is more just all around like med
Then
surg,
nursing
medical,
homes,
yeah,
med
nursing
surg.
homes. And second year is a little bit more broken up. So you do like labor and delivery, you do pediatrics, mental health, and then the medical again, and OR.
So
Okay.
you have to do clinicals in every
Unit.
specialty,
Yeah.
Oh,
even
okay.
if that's not what you want to do.
And how do you decide? Is that just something coming out you decide? Because like engineering, prior to being and like getting your degree, you got to choose mechanical, civil, whatever.
Right.
Is that kind of how that works?
No.
You
No.
can, and like we could still transfer to any department we wanted to.
Do you have to
at any
get
time.
extra certified or anything like that? You're pretty much
You would go
good.
through orientation in that
Mhm.
unit just to get used to it.
Huh.
Oh, if you're a nurse anyway.
Yeah.
Really.
Mhm.
That's pretty
For
cool.
us, the labor and delivery is really
It's a
specialized.
specialty unit, yeah.
Oh, really?
So the
yeah.
orientation and stuff takes a little bit longer.
But for med surg, ICU, and all that, it's kind of the same orientation.
Do you ever see that side of the when you're working? Are you strictly just delivery?
Well,
So we do everything. We take care of people with post-ops. We take care of people with kidney infections.
So
We
we-
do
in
the
the
labor, the
L&D
delivery, the babies. We do C-sections, so we do OR. We
Yeah.
kind of do everything.
we do
in our
everything:
unit.
ICU, med surg, surgical, everything pretty much.
That sounds like a lot of
Like we'll have patients who are on magnesium drips,
Drips,
and if
yeah.
it was a med surg patient, they would go to ICU because it's on our unit. We
We
keep
do
them.
it.
Oh, okay.
Yeah.
When it comes to the hospital, there's so much going on. I feel like because there's like you said, ICU, all these different areas. Can you tell us a little bit of what your daily routine is? I know it varies because
Yeah.
obviously things change.
Well,
but-
because we're like an ER, so at any minute we can get more patients.
Mhm.
okay.
They just come straight
We're
to
an
us.
ER for pregnant women, yeah. It really depends what we have on the floor. Usually, like, one nurse will take a labor. It depends, like, what meds they're on, if they'll be your only patient or not.
Mhm.
So sometimes, depending on what they're doing, you'll have a one-to-one. So in that case, you know, we have to watch. We have 2 patients, a mom and a baby, or 3 patients if they're having twins. So we just monitor them. We have to monitor their baby's heart rate, their contractions every 15 minutes. So that's stuff I think people don't really realize how much we have to chart in the labor.
Yeah. As a nurse, are y'all like, is y'all just with one doctor, or all the doctors that are there, like, are y'all assigned to all of them?
One doctor's on call at night.
Oh, okay.
And if the midwife's on, then she's on, but she'll have a doctor backing her up.
You want to explain midwife? What's that?
They just been
A
there.
midwife is a certified nurse midwife. So
it's
she
like a
just went to
nurse
school
prep level.
longer. Yeah.
Okay.
And she can do pretty much everything except surgeries.
Yeah, so
that
she
the
can't
doctors
do
can
C-sections, or if the labors get super high risk, then it'll transfer over to the physician.
Oh,
But she
okay.
delivers our babies too.
Do you guys ever get to sit in on operations?
We're in
Well,
every
we're in-
situation.
Yeah.
Okay.
Yeah.
Because we have to catch the baby.
Mhm.
Like,
Once
what
the
do you
baby
like
comes
if Tom
out.
Brady threw you a
Yeah.
pass? Like,
Out of the-
That happens
out of-
sometimes.
We have a net.
No way.
Actually, a bag, really.
Yeah.
But
No, once the doctor takes the baby out and cuts the cord, he'll hand the baby to us, and
okay. You
Make sure it's
clean
okay,
them,
take care.
start taking the vitals and stuff
I
like
was gonna
that.
ask if y'all want to be a Mikey. I got hands like that.
we
sometimes
you
they fly
have to.
out.
Yeah.
Huh. Well, that's interesting.
I think I want to see one time this baby tongue. I want to see how it looks, bro.
Okay, so on that, on the, I don't want to say grotesque topic, but what was your first experience, each one of you, when dealing with blood, and how did you handle it?
I've always been okay with blood. It
Really?
didn't bother
Hasn't
me.
bothered me either, yeah. I don't think
It's
I've had
stuff
anything
like-
that's, like really grossed me out in our unit.
It's stuff that like med surg nurses deal with, like spit, phlegm, and stuff like that. That's what I can't handle.
Okay.
I can't handle blood when I throw it.
Yeah.
I'm talking about phlegm, like when they hack it up.
Oh,
Uh-uh.
yeah, you're
No.
right. I guess you can't do it.
Have you ever had an experience where, such as that, like you just get, I don't know what the right term would be, but where like blood's gushing?
Oh, yeah. Sometimes you'll end up with blood all over your clothes, your shoes,
Sometimes
change
other
everything.
fluids.
Yeah.
Yeah.
Dang.
I don't think I can make it in the yard.
I don't think I could do it either. That's why I definitely appreciate
Yeah,
what you guys do.
absolutely.
I mean,
It's a lot.
it's not an easy job, especially when you deal with, I'm sure, more times than none, patients that are inpatient. Is I'm sure that happens
I never
pretty
thought
often.
about that.
It does
They
happen,
want to
but
know when is the
yeah.
baby gonna be here, and they get a little.
It does happen, but I've gone to other units and like
It
med
can be
surg
the
and
same.
ER, it's way worse. They're
Really?
rude to their nurses. Our patients are a lot nicer.
Usually pretty appreciative,
Yeah.
because it's usually happy circumstances.
Mhm.
I was gonna say that seems pretty on the better half of people and their
Mhm.
attitudes because it's a baby.
Right.
So I know you obviously have a child. I know you have kids. There's always this when women are pregnant and they're pretty much due. There's what they would consider remedies to trying to help with the process. Is there anything you've seen or suggested to patients that seem to help more than other things?
Don't drink castor oil. That's a good one to start.
You hear
off
that?
with.
Yeah,
drink
don't do
castor
all those
oil.
remedies that you
I mean,
hear.
I'm not sure why you would do that.
Oh, it happens.
Yeah.
Yeah.
Is that the weirdest thing anyone's ever tried?
What is the
it
midwife?
seems pretty high up
Yeah, I
there.
don't know. There was some type of midwife brew. It had castor oil in it. I don't know what all was in it, but it's all just a bad
And then
idea.
A
to
patient
do.
of ours took that and she just came to us sick.
Yeah.
It didn't help.
I'm not surprised.
I always
just walking.
yeah.
Walking?
Is good. Yeah.
Or squats or sleeping,
Squats.
because the more that your hips are widened,
Right.
the more the baby can come down. So I just say walk, squats, put a pillow between your legs when you're sleeping.
Okay.
Birthing ball.
Drink plenty of water, because if you get dehydrated, you're gonna have contractions, but it's not gonna do anything. Once you come in, we're gonna give you fluids, and they're gonna go away.
Okay. So stay hydrated, ladies. Maybe walk a lot.
Squat. Squat.
If you could squat.
Not just for
I've
baby,
seen-
just
so-
squat in general.
I notice though that women that are pregnant, some seem to get huge. No offense, but and some are super tiny. Is there a reason for that? Or it's just body type.
Yeah, everybody carries differently.
Then
It
also some
depends
people
on-
think they're supposed to eat for 2 when they're
Right,
pregnant.
diet.
When really you're only supposed to have like 500 more calories.
Huh.
Yeah.
That's interesting.
So people think when they're pregnant they can just eat all they want.
Really, like if you're a normal body weight, you should only gain like 25 to 35 pounds max.
Extra.
And I've seen somebody gain like 60, like
80.
and it can be really hard on your body
Yeah.
if you do
I
that.
can
And
imagine.
you
Straight
have
back
more
problems.
risk of going to a C-section
Mhm.
when you gain that much weight.
Really?
Yeah.
Is that more common than actual natural birth?
Our C-section rate is pretty low,
Yeah.
actually.
Okay.
We do pretty. Our doctors
do
do pretty good
everything we
with
can.
trying to.
For that not to happen.
Yeah.
There's also the theory that women that are pregnant, if they hang low, it's a boy or a girl, or I don't know these things, so I'm learning. What's you guys' take on that?
I think it just varies
Yeah, I
because you
don't-
can be pregnant with a boy one time and have these symptoms, and you can be pregnant with a boy another time and it be the complete opposite.
And then with your second kid, you always are going to carry lower than your
Lower.
first.
Because all your
Okay.
muscles and
Yeah.
everything are stretched out and weaker, so you're gonna hold lower anyways.
So you've had both.
Mm-hmm.
I've had both.
You've had both.
This is good
Did you
information.
know prior to? Did you have a guess?
With my first, I totally thought he was a girl, and I was so shocked to find out he was a boy. And then with Talia, I just hoped it was a girl, so I had one of each, but I really didn't know either
I
way.
don't really know either.
Some people are good at knowing, though. I don't
Yeah.
know how.
They
Huh.
say with a girl that you crave sweet stuff, and with a boy you crave salty stuff. And that was true with me. With my son, I wanted nothing but salt.
Huh.
Like chips, anything with salt on it. With my daughter, it wasn't like that, so I don't know.
Did you have any of those? Did you have weird cravings?
I was gonna ask the opposite. Did like your spouse have weird cravings?
No.
No, I don't think. Well, with Troy, with my boy, I would always like crave veggie trays. That's like all I would eat with him.
That's boring.
Well,
I was gonna say, it seems like she was on that perfect, not gaining that much.
She was that baby nurse nose
Yeah.
diet.
Yeah.
they say too, like with girls, you have way worse morning sickness because
Okay.
like extra female hormones. But mine was opposite. I was more sick with my boy than my girl.
Hmm.
I don't know.
So
I didn't
weird.
get sick. I was lucky.
Yeah, you or like.
Off camera, we've had conversations about twins.
Mhm.
Let's talk about that. Is that the most you've seen is twins or triplets or what's?
I know somebody who had triplets, but because that's so high risk, they would go to
Go somewhere
Albuquerque
else.
or Lubbock or.
Why is it high risk?
There's very small chance they'll actually carry to term, so they'll have to be born pretty early. So they'll need to be somewhere with a intensive care unit for babies.
That sounds like a lot of trauma too. It's like, damn, 3 kids.
At one time, that seems like a lot, especially if you
In a
don't have
lifetime,
any
that sounds
kids.
a lot.
Well, I mean, well, yeah. I think if they're spread out, 3 kids seems okay, but one
Three
time,
newborns,
and if
3 toddlers. Oh,
Oh,
Yeah.
yeah.
Never thought
So-
about that.
what's the likelihood of twins being identical and being opposite?
Fraternal twins are genetic because that means you release 2 eggs at once, so they're 2 different DNAs, 2 different babies. An identical set of twins is just it just happens when
It's
an egg
basically a
splits in
miracle
2.
baby.
Yeah.
Okay.
So I don't know like what the averages are on one or the other, but
My sister-in-law is a fraternal twin, and she just had identical twins.
Wow.
See, we're twins.
Really?
We're not twins. would you think that?
Yeah.
That's so funny because I don't know what it is, but as of lately, probably last month or so, we have gotten the question of, are we twins?
From old ladies to little kids
To-
it
just-
It's similar, but I don't think you look.
I think, but you do
You could
know
be fraternal
though.
I
twins,
did know
though.
already. Yeah.
Yeah, she knew. How far of a difference do you think we are? Like as in age?
I don't know.
Guess.
Who's,
No, you're not
who's
gonna-
older?
Who's
You.
old? Okay. By how much?
3 years.
Close 5.
Oh, I gotta get in the gym.
Well, that ain't helping right there.
It's like wine, bro.
Have you, or either one of you guys, experienced giving like receiving twins?
Yes.
Yes.
How does that feel? Because I'm sure it's time lapse, like one comes in the next, and how much
It
time
depends
varies.
on how it. If there's
Yeah.
there's gonna be 2 nurses for each baby.
Oh, okay.
So, like C-section like twins, they're pretty well controlled. And I've been in for 2 vaginal deliveries of twins, and that's kind of hectic, honestly. But it's awesome, I think. Usually, one baby's always worse than the other. That happens like
Like
every
later
single
on in
time.
life?
No, like with breathing when they're born.
Oh, okay.
One
I
baby's
see.
always a little bit more stable than the other.
Huh.
I love twins. It's like my favorite thing, honestly.
Really?
Mhm.
Huh.
I'm not a real big fan of the twin thing. Not a big fan.
I'm getting that you're not really a big fan of the kid thing.
Yeah, I'm getting that vibe of it too.
Y'all read vibes good.
I guess it would just depend. Like if it were,
I love other people's
I
kids.
think if it were the first kids, twins would be okay. But if I had kids and then we popped out twins, I'd be like, man,
You're only
like I
expecting
had
one.
2 and now I expected 3 and I got 4.
Can I return like one?
One of our nurses, she has 4. She had 4 kids under 4,
Mhm.
and the last set were twins. And she's like, when they start coming in 2s, that means it's time to stop.
Yeah, that's a little extreme.
A
It's
lot.
really cool though, because I
It
used
is.
to think that when you're having twins, you just had to have a C-section. But our doctor, Dr. McMillan, she will, if one baby's breech and one isn't, she'll deliver the first one and then turn the second one. So if you wanted to have a vaginal delivery still, you could.
Oh wow.
But it's all done in the OR so that
anything
if something happens, they
yeah.
can cut right away.
Oh
How do
man.
you turn a baby?
Pushing on your belly.
Well, like,
Yeah.
I'm sure it's gotta be gentle and
It looks pretty bad.
really.
But she's really good at it.
Yeah, but
Yeah.
she's good.
The first time I saw her do it, I was so amazed.
It's pretty cool.
Yeah.
I gotta see some videos of turning babies.
Cephalic version.
It's crazy because a buddy of mine and we were talking recently, and like technology has advanced so far because it seemed like probably 90s and before, injuries like an ACL or an Achilles, you're pretty much done with like sports and stuff, and even like sonograms back in the day. I'm not sure when they started doing that, but but my understanding is, one, it's pretty clear cut these days, and is it true or is it a rumor that they're starting to come out in color, or they're venturing on in color?
I mean, they're not black and white. Like the 3D ultrasounds are kind of almost
Brown.
yeah, brown or yellowish, but I haven't heard anything about like
Yeah.
full color. Yeah.
That was something I recently literally heard like within the last few days, and so I was all, dang, that's so awesome that people these days see their baby and they can see everything
Mhm.
down to the features for the most part.
Mm-hmm.
And what is the likelihood the doctor were to get it wrong? How often do you see that with the sex?
I've seen it one time and that's it.
Yeah.
One
Aside
time.
from that one, I know one other person who that happened
And how far along? When do they know? When do they get the guess? And how far along did they go till they knew they
to. When
were?
the baby was born.
Yeah.
Yeah.
Oh.
Because if you have like a normal pregnancy, you'll have your anatomy ultrasound around 20 weeks, and that's when you find out if it's a boy or girl. And you usually won't get one again until you deliver, unless you're high risk. You'll get more, but
Is there any risk to getting too many sonograms? No,
I don't think so.
nothing.
They'll give you more if you're a high risk pregnancy. Then you would get one
Oh,
like every
okay.
month.
yeah, if there's
But if
anything they need
everything's
to
fine,
watch.
then they wouldn't give you very many.
Huh? guess it doesn't seem
How would
bad.
you feel if you were about to have a girl and then it just popped out? Poop, there's a boy.
As strange as this sounds, I already have two names that I like, boy and girl. So I think if it were to boil down to the doctor was wrong and we were misled, I really wouldn't mind.
So I'm gonna be an uncle pretty soon. You're saying you already have names.
No, not at all. No.
So you're our brothers though?
Yes.
Yeah. That, did you not think we were brothers?
Well, y'all are like, how do we don't look alike, but
No, I never
think
said we didn't look alike.
Okay.
I think we look alike.
No, we've just been getting the whole twin
like
ass.
I've been lied to this
No.
whole time.
No, we've just been getting the whole "are we twin" question
Okay.
a lot. Like, we're at Walmart, we were at a yard sale the other day. Like, they ask us, and I mean, we clearly are honest with them.
They
and
always ask if my brother's my husband, so I think things could be worse.
I mean, they could ask if he's my
I'm like,
husband.
stand 5 feet away from me and my kids, please.
I don't know.
That would be an odd one.
Yeah.
I guess I'm okay with the twin thing now. After that,
Yeah, pretty much.
Just with your partners, at least.
what? Do you remember the first time that you guys started working?
Mhm.
You want to tell us about it?
I remember my first week of orientation, we had this girl. It was like her 4th baby, so usually, sometimes they tend to come a little bit quicker the
Okay.
more babies you've had. And she like sneezed and her baby came out. There was no doctor, and I was like, what did I get myself into? I was panicking, and everyone else was like, this is totally normal. And I freaked out that first week.
Oh
Yeah.
my!
You should never tell me stories like this.
Did you catch the baby?
Well, yeah, a nurse was in there, but
Oh yeah.
like I did not expect. I thought it was going to be so much more well-controlled environment than it is.
You don't realize how much nurses do until you
Mhm.
become a nurse.
Mhm.
They do so much. We do so much. All nurses do. It's crazy.
The doctors
It's always the
don't
same.
care
Like
a lot.
nurses know more than the doctors most of the time. It's like you do more than like the doctors as well. Like,
We're more hands-on for
Yeah.
sure. They come in for like the delivery or if there's anything, worrisome going on, but
Yeah.
otherwise we handle it.
yeah, doing like all the vitals and all
Mhm.
the sticking with the needle and
Mhm.
stuff. Yeah, no, not to miss with nursing.
All the cervical checks so we know how dilated they are when they're ready to push. It's all us.
And your first day or week?
I don't remember a certain story. I just remember it's like hell when you first start.
That's
Like,
a good
They
description.
teach you in nursing school the basics, but when you get to
You learn like
the real thing,
95% on the floor.
yeah, it's overwhelming.
So basically, you wouldn't be able to prepare for that.
No.
You just gotta experience.
Yeah.
That's
I could just imagine, 'cause, like going to a new job and starting your first day is kind of like, what the hell do I do?
Mhm.
Imagine being a nurse on your first day, like what the hell do I do?
because you're around a lot of ill people needing emergency. Like, did you start in the delivery?
Mhm.
So that's where you started, and you've been there ever
Yeah.
since.
Yeah.
Huh?
We do nursery too, like with the babies. We kind of do everything in our department. 'Cause
Okay.
we're at LDRP, so we'll do the labor, delivery, postpartum, recovery, and babies. Some hospitals, you have a labor nurse, you have a postpartum nurse, you have a nursery nurse, and it's kind of split up, but we do everything at our hospital.
Dang. How many of there are you, as far as delivery
Well,
nurses?
like at night, it's just me and Heather.
Yeah, 2 L&D nurses, and then we'll have one more to be in the nursery if we have any sick babies.
What's y'all's hours? Like y'all's.
6 to 6.
That doesn't seem too bad though. I'm sure once you get used to it, because you don't do shift work, right? You don't go nights to days to days to nights.
No.
No, you're nights, right?
Yeah.
Yeah. So it's like,
We kind of do though, because we're parents. So when we're
Oh.
off,
Sleep a whole
yeah,
lot.
when we're off, we're daytime. Then we go back to nighttime.
Yeah.
yeah, that's
Ooh, that's
true.
rough.
That is a little
Would y'all
tough.
ever like switch to a different department?
No.
I want to become a midwife, and that's about it. That's as far as I'll get out of the unit.
No travel nurses for y'all?
Maybe
traveling, it would
eventually.
still
It would
be
still be
L&D.
L&D travel. Yeah.
Okay.
Everything else is gross.
I could see myself doing ER, maybe, but that's the only other unit I think.
What consists of ER? What's obviously emergencies, but just every kind of trauma that walks through the door.
Mhm. Psych, medical trauma, even like the little things too. People go to the ER
It's all a big no to me.
for.
You're like babies, and that's it.
Yeah.
Yeah.
It's got to be quite the experience. Like you mentioned earlier, it's always, I'm sure it's always, most of the time, good vibes.
Mm-hmm.
Because it's a baby. I mean, who don't like babies? Except you.
I didn't say I didn't like babies. I just
kidding,
don't
I
want to
just-
have a baby.
Let me see. I want to ask something. I don't know. Maybe you guys don't want to voice your opinion, but I at least want to ask. Is there, or should there be, a cap on babies? Like for... I'm
I
curious
think it depends
because...
on the situation. Some people want a lot of kids and they're financially stable, and then there's other people who keep getting pregnant and don't keep their babies, or you know,
Right.
but
But
it's all
that's kind
each
of.
person's choice.
Not
type of thing.
necessarily a cap. That maybe I phrased it wrong, but like she said, some people have maybe one too many babies, and I mean, I would
You're
like to
right.
get it from your perspective because you see it and stuff, and so you know.
Some people should be a little bit smarter with birth control.
Or condoms.
Yeah,
I
it's
mean,
kind of easy to prevent, but
so on that note, who was the youngest, not, you don't have to name a name, but youngest age you had to experience when delivering a baby?
I haven't had that yet. Like 16 is my youngest so far.
we had a 15-year-old.
But I've heard of like 12
We
year
had a
olds.
I know that, like there was a 13-year-old at one point.
Wow.
13.
13.
I
I mean, that just seems
don't even know what I was doing actually.
extreme.
That's-
Like at 13, I think I was maybe an 8th grader?
Yeah, I have a friend whose mom had him at 13.
Wow.
Yeah.
Whew.
and
That just astonishes
then his
me.
brother at 15, so.
She's only like 45, 49.
Huh?
She's good. She's like in that 40, 45 range. she's probably living life now. We're like 25.
I don't know.
28.
I don't know. I guess that's the part that I'm just. For instance, 13-year-old. That's too young to me. For me, like, she's still a kid,
Yeah.
and it's tough because I'm not sure how she's doing as far as life goes, and
Mhm.
you know. But hopefully, well.
We do have a lot of resources we give our teen moms, though. There's a lot of different things in the community that can help them out, though.
How so? I want that. That's
We
good.
can
'cause
get them on Medicaid. There's the WIC program. There's something called Families First. And
Okay.
if it's your first baby, they come and do check-ins with you and different things like that. Make sure your baby's reaching your milestones and that mom's doing okay.
Huh.
Yeah.
That is good. See, I didn't know any of that. So
Mhm.
that's a big plus, especially when you're so young. Do they have to verbally ask for assistance like that, or is it kind of just suggested for them?
Most of the time, we'll just talk with them and figure out
Yeah.
what situation they're in and kind of what they might need,
And then we
we'll
just
give
refer them.
yeah,
Okay.
referrals.
Okay. So you young ladies having babies, don't do it. But if you did do it, there's help and assistance for you. Man, that's crazy to think that it does happen though.
Mhm.
It does happen. Have you ever experienced a situation like is it called a surrogate?
A surrogate.
Surrogate?
Mm-hmm.
Have you had that experience before?
I haven't.
No, we've just dealt with adoption.
Mm-hmm.
Okay. And when you say adoption, what exactly? How's that work?
It's different. Like some people will already have the person that they
Picked
want to
out.
adopt the baby,
Mhm.
and they'll
Okay.
come with them.
And
They already
just-
have all the paperwork ready and
Yeah.
everything. And then others, they don't have everything ready. They just know that they're not ready to have this baby.
Oh, okay. Man, that's kind of. I mean, I guess it's good for the baby's sake,
Mm-hmm.
but I don't know what I would
Would
do.
you go that route, the surrogate route?
Okay, so you guys know about that. If I, as a single male, is it hard for a male to have that? Like even maybe just adopt. I'm not sure if you know much about adopting. I know that's probably not your full thing going on, but is it hard for somebody like if myself, like if I didn't want the whole baby mama thing, but I wanted a child of my own? Is that hard?
I've heard it's a little bit more difficult for like a single parent to get approved, but it's not impossible.
Okay,
Yeah.
Even if it was like a single woman,
Mm-hmm.
I
right.
think it's still harder.
Yeah.
It's harder for women.
Just
Or
a
no.
single.
Oh,
Just
it's
single.
single
Yeah.
in
Yeah.
general. Oh, okay.
Because it's hard to be a single parent.
Right.
There's a lot more struggles.
I would probably beg to differ. I'm just kidding. I wouldn't know. I don't know. I don't have any kids. But the thought of picking the wrong
Mm.
baby mama is fearsome.
Yeah.
So the thought has.
He said it about 7 episodes already, so.
I just. Well, and I got women that deliver babies, so I'm just kind of like, well, I need to ask.
He's like, well, and then what if one goes up for adoption?
Well, I'm sure there's women that are like, man, I picked a crappy baby daddy. Like it happens on both sides, so
Yeah.
it happens.
Honestly, CYFD is looking for foster parents. We have a lot of babies who get taken or go to CYFD, and I know they struggle with finding foster families for them. So,
Really?
if anybody's interested
Anybody
in fostering
like
babies or children,
like a baby that needs a home?
Or a child.
Does it vary from ages? And how does that work? Like, you say they have children. I hate saying available. That sounds so bad. But you
In
know what I
need.
mean? In need of a home.
They just have more children who need a home than they have.
for people to
Foster
take them
families.
in.
That's so sad. I don't know how to explain that. That's the toughest thing these days.
Yeah.
And so,
So then, do people just go like to CYFD and like apply? Or how does that work?
Yeah, and they'll usually, I
They'll
mean,
do,
you have
like,
to have
home
background
visits
check,
and
home
stuff.
visits, and you have to go through like some classes and stuff. But
Yeah, I'll probably need like a lot of classes. I don't even know how to hold a baby, so.
neither do a lot of our
Yeah.
parents. We teach.
I've
y'all
never-
teach?
Yeah,
Really?
Oh, that's
how to
like,
change diapers, how to
that's like
hold
most
them,
of
how
our
to wrap
job.
them, how to dress them. Yeah, a lot of teaching.
Oh, I know how to dress them. What just you know how to wipe
They're
them?
like
You need
scared to
everything
pull their
else.
arms through the sleeves, you know, stuff like that.
Babies seem very delicate. And they are. But
They need to get their
Yeah.
stuff together.
sometimes, like, whenever I'm like holding a little baby, I feel like,
You had a baby before?
yeah.
I
And
never
it's
had
just
one.
kind of like, I feel like they're super fragile. I don't want to even breathe.
I feel like Gronk, boy. I feel like I'm just ready to
I'm just-
I'm just.
It's kind of, I don't think I get anxiety, but if there were a time, that's the one time I
Yeah.
think I get it because I'm like, I don't want. So on that, if you ever happen to have an accident and you drop a baby,
No.
No.
Hey,
are you lying?
No.
I don't think they can work in a little.
Well, I mean, like,
Can't
I'm
drop
sure it's
babies.
chaotic at times.
Yeah.
Accidents happen.
They do shoot out like a damn torpedo.
And
Guys.
yeah,
No. Thank God.
Catch with
That's
your body.
Yeah.
Damn.
and then they drop me.
A few times at least.
No, I think mom told me they dropped me.
On my head a few times.
I'm just kidding. I don't think so. I don't know, mom. Did they drop me?
There's plenty of people who like drop their kid when they're older, or they
Purpose?
roll off the bed and hit their head or whatever. But no dropping newborn babies.
You know, ever drop those kids?
No.
One time I opened the car door and Troy fell out and hit his head.
I thought you
but
said you hit him with the door.
I didn't hit him myself.
Have you ever experienced where the dad was there and they either fainted or whatever?
I had one guy get close to fainting, and we had to have him sit down. But
I had
actually,
one guy
everyone
throw
was
up.
pretty
but
good.
Oh, I
He
guess.
was not into it.
I think I'll be a champ in that.
I think I'd be cheering him on.
cool.
I'd be
I'll
telling
be
him.
like, you got 5 minutes. Take it or leave it.
When you have a baby, I need you to come to us.
Yeah, I would.
Take it or leave it. I'm gonna put a timer on it.
No, I think I would be.
She should have never told me that story about
Do you
sneezing.
guys get?
I'll be like, you sneeze, I swear.
It really does work.
Sneezing,
Throwing
laughing,
up.
it's the same muscles you use to push.
Well,
so-
good thing I'm funny, so I can make them laugh. So
Yeah.
they're not.
You can.
Don't
We've had
sneeze.
people laugh their baby out.
Yeah.
So from experience, what are some suggestions for men that are there with their significant other having a baby? What are some of the things that work for you to maybe calm you down, relax, get you through the process a little better?
Don't eat in front of them.
Yeah.
Okay.
They can't eat.
Okay.
Be supportive when she wants you to be supportive, but when, like, especially if she's doing natural labor, she'll get to a certain point where she doesn't want you to talk to her. She doesn't want you to touch her. So be in the room, don't leave, but just listen to what
She's
she
gonna say mean
needs.
things to
Yeah.
you. Just don't take it to heart.
Yeah,
Yeah.
because she won't remember any of it anyways.
Oh, really?
Yeah.
Wow.
You get like an amnesia type thing.
I had a girl slap her husband.
Domestic violence. Chokehold.
Chokeholds, you know.
Really?
Do you guys get
Oh,
like
no.
supernatural strength?
Because
I know there's like TV shows where the lady's holding the guy's hand or someone's hand, they're squeezing the crap out of it.
yeah, that can happen, I guess. I think it's more you just don't care if you're hurting the other
Yeah,
person, so
'cause you're just
'Cause
you
you're
don't
in
hold
pain,
back.
yeah.
Yeah, you don't hold back at all.
What about at-home births? Do y'all recommend?
Oh no, we don't.
Why is that?
There's so many things that can go wrong.
Really? How does someone go about that though?
Get out again.
Well, no, because I know there's like I think there's like a jacuzzi pool thing they do it in,
Some
right?
people
Or a tub.
do, yeah. Some people do that if they do home births.
I don't know how they do that around here.
Yeah, I don't know either.
Seems super old fashioned.
So that's like gonna be my thing, because I'm not gonna do vaccinations, so in-home births probably gonna be my move.
For you personally?
Yeah, personally, like if my girl was like into it, like I'd be like no vaccinations to the in-home birth, like.
But I'm sure there's precautions for that because the
Absolutely,
thing
has
is, you would still want your stuff. Because what is it all? So tell me, I would like the process. Lady comes in, I'm the lady, I'm in a wheelchair, I'm coming through the emergency, I'm pregnant, my water just bursted. What's the process?
So we make sure your water actually broke. The test.
Why does that not
Yeah.
You
always
could pee on yourself when you're pregnant. There's a whole bunch of different things that
Really?
can happen. Yeah.
Huh.
You have like a huge baby pushing on your bladder.
Oh, I guess that is true. My bad.
Where your body starts,
I was like, you need to pee. Okay.
where your body will start producing more vaginal secretions to lube for the baby to come out, and
Okay.
they can also be that.
Yeah.
Oh,
So
okay.
we'll make sure your water broke first. If it's broken, you're obviously not going to leave until you have a baby. Because once your water breaks, there's a risk for infection. So you would stay and get induced or whatever it might be till your
But
baby's
it's
here.
good to come in whether you don't know if it's your water or if you peed on yourself. Come get
Okay.
checked out.
Because if your water did break and you stay home for days and you get an infection, you and your baby can be super sick.
How do you know if it's really broken?
We have a test that tests for proteins in amniotic fluid.
So it's like a coin little thing. You just drop a little like dial.
It's a swab.
It's a
Oh, it's a
Q-tip.
swab.
Yeah. But if your water was broken, we would start an IV. We would first put you and your baby on the monitor. So make sure baby's heart rate's stable. See if you're having any contractions, what that pattern is,
What your
how
cervix
dilated
is.
you are, yeah. And all that would kind of gear which direction we go in.
And like, what diameter do you need to be to like push the baby
10
out?
centimeters.
How big is that? Like 5 inches?
Big, around.
Oh,
Yeah.
it's not very big.
They have a bigger head than normal.
Yeah.
Like, it's-
That was gonna be my next question. What is the biggest baby you've ever delivered?
12.8.
I'd be
What's
12 pounds,
normal?
8 ounces. Pretty normal is like 6 to 8 pounds.
Mhm.
6 to
Okay.
8.5.
So
is like
double.
normal.
You doubled a baby.
I'd beat that.
That's a big
Most
baby.
babies aren't
He's
even
like in
that
size
6
3 months. Yeah, like size
Oh
3
my
months clothes when that's born
goodness.
You
already.
remember how much you were? How much you weighed?
I think I was 7'7".
I think
No
I was.
joke.
I think I was in double digits. I think.
Really?
I think so. I think I was in double
Dang.
digits.
And I think I was born at 7 o'clock that night.
I was gonna say
I know
11,
I was
but I don't
born
know
at
if it's right. I think around 11. I think that was the way.
I'm pretty sure. We're gonna have to confirm this, Mom. When I was born.
I never asked really, so I think it was about 11.
I'm pretty sure.
I had a
Do
bigger
you
head
know how
than
much
normal.
you weighed?
I was 6'11".
That's
What
not
about you?
I
really-
think it was like 7'5".
So we're all normal.
So I was fat and big headed, huh? That's what it was. That's how it is. That's why when I
Typically,
was a kid, I was
for a
overweight.
woman, is there ever a time that you should stop breastfeeding?
About 6 years.
No, because I know women that breastfeed for a while.
I
think it's
mean,
their
it's personal choice.
Yeah.
Yeah. Obviously, if you have any type of sickness or are on any medication that you have to start taking that you can't breastfeed with, then you should definitely stop. But other than that, I mean,
I
everybody's
never thought about
different.
that, like, medication, like, prevents you from doing something.
Well, that's another thing is when it comes to breastfeeding, is there anything you should avoid while breastfeeding? Whether it's alcohol, medication.
I'm sure there are medications you can't take, but depending on why you're taking it, there's almost always an option you can take that's safe. You shouldn't obviously drink alcohol and then breastfeed for a little while after, but
Marijuana, same thing.
same thing, yeah, because it could sedate your baby. So that's really the big thing.
Yeah, that's the problem. That's what's fun.
What is the longest that a lady was there until she either, or
That's a
I'm
good
all
question.
mine.
That was a good
how long
question.
were you there?
45 hours in labor with my first.
2 days?
2 days? That doesn't seem that long. I mean, I don't know. I'm just saying.
2 days don't seem long. Have you ever stayed
Well,
in a
I
hospital for
don't
2 days?
know. That's why I'm asking.
That's a
These are
long
questions.
time.
That's before I even had the baby. Just 45 hours in labor.
Oh, okay.
Like, that's different.
Okay. When you put it
Hers
that
was
way.
like 6 hours, yeah.
Was it?
Yours is nothing.
Mine
Was it yours? Or you just feed yourself and you didn't know, and you just stayed at the hospital until you got the baby?
Yeah, that's what happened.
Is that what it
My water
was?
wasn't broken. It's just very, very slow progression.
Oh man.
So, outside of yourselves, what's the longest?
There was a lady the other day that was 42.
Yeah, like 42
Oh, so it's about
hours.
2 days.
Those are extreme.
Yeah, that seems like a lot. I personally, I guess, I thought maybe a few, like a good 5 days. I don't know.
What's the
I don't know.
fastest?
5 minutes.
Yeah, like somebody
they
walked in
came
the door,
laid
made
on
it to the bed, and had a baby.
See,
Those are
5
fun.
minutes, bro. I'm telling you.
We've had babies born on the way to the hospital, you know.
Oh, that sounds crazy.
Like in the ambulance?
Oh, or at home.
Ooh, what the? Oh, that would be scary. Like you just kind of scary.
I hear if you can get there without an ambulance, it's probably suggested because that ambulance bill is pretty expensive.
And also, you have
Probably
to
so.
wait for them.
To get there.
You
Probably
guys
faster.
the gas, bro.
But-
That's kind of high.
I mean, if you deliver in your car by yourself and you don't know what you're doing versus pay the money and have an EMT there to help you deliver your baby.
Oh, I don't know. That's
Hopefully, when I have a baby, Adam and Heather are there, and her, so we can just get it all together. You know. Oh yeah.
We're pretty successful at
It's just
having
gonna
people
happen, it's
deliver.
gonna-
We're pretty
Yeah.
like, let's get this baby delivered, but
Is it like an adrenaline rush whenever it's like you're just sitting there waiting to catch it?
Well, when they come in, lay on the bed, and the baby pops out, that's a
That's
good
a good
adrenaline
adrenaline.
Like,
rush.
how do you catch it? I just have to know. Like, is it
so
just
like the head comes out, you make sure there's not a cord around the
Oh.
neck. If there is, and if it's loose, you slide it over the head. And then you deliver the top shoulder first, then the bottom shoulder, and then the rest kind of just slides out.
Oh, for some reason, I was
easy
thinking- I
peasy,
thought it was
bro.
like a slide, bro. I thought it was the feet first.
A slide?
I didn't know the head came first. I
The
didn't.
head-
well, no, that's like necessary.
Should definitely come first.
Oh,
yeah.
I didn't think about it. I was like,
There's a lot of things that can happen.
Yeah,
It's
if
like
a baby's
forward.
breech, then you have to have a C-section. Unless they try to turn the baby.
I see, I see.
Dang.
Never thought about it actually because I never had a kid, so I didn't think.
Definitely want him to be head no.
Yeah, I think I knew that one. That was like one of the few things I knew. And the water busting, that's one of the other things I knew.
Yeah.
Does anyone ever, I know there's premature babies,
Mhm.
does anyone ever exceed the 9 months? Have you ever had
Yeah.
someone exceed?
Like at 41 weeks. So 40 weeks is your due date, and then if you don't deliver by 41 weeks, they'll usually bring you in at 41 to induce you.
Dang. And that's a C-section immediately?
No.
We'll
No.
start a medication through your IV usually, and that
Mhm.
causes contractions, so you can start labor.
Dang. There's medication for everything.
Yeah, everything.
Because we
Bro.
were talking with another guy recently, how there's something that it's like your adrenaline, your heart rate's high, so they give you something to lower it
Mhm.
or speed it up,
Mhm.
vice versa. And so, again, the medication, it's so
Crazy.
advanced these days. You can make a lady have a baby.
Yeah.
Then he was saying you could stop his heart and then just pumps right back like that. It's like,
Yeah.
That's
You
crazy.
can try to stop a labor.
Mhm.
You can start a labor.
Why would you want to stop them?
They're
If
preterm.
they're too early.
Oh.
What's the earliest you've seen as far as premature?
That's delivered with
Mhm.
us.
Wow.
25 weeks.
Well, yeah. You
Technically.
count the.
Like ones that survived at 28 weeks.
That's gotta be.
Cause yeah, I think she said 40 was the due date. 28, 25. That's a little bit more than half the week. Bro. Damn, that's crazy.
Yeah, that's super tiny.
Yeah, I think
How small is that baby
Like a
typically?
4 pound.
Maybe a pound.
Maybe,
Yeah.
A pound? Oh my goodness. And what usually, if you know, what happens like that makes a premature baby? What usually goes on there?
They could have an incompetent cervix.
Yeah.
So their cervix is
If
dilating.
it's weak, it can't hold the pressure of the pregnancy growing, so it just opens.
So they would need to have a cerclage the next time they got pregnant.
And that's like you stitch the cervix closed to keep it closed during the pregnancy. And other times, your water just might break and there's no, like, you can't go back from that, or, you know.
Dang, so it's super random.
Mm-hmm.
That's what it's
How often does that happen?
That early, not super often, but like after 30 weeks up to 35, you have a lot of people come in with contractions that you stop.
So it's kind of normal once you get past 30.
More normal, yeah.
Okay.
Yeah.
And if they're 35 weeks or above, then we can deliver them at our hospital.
Yeah.
But if
Okay.
it's younger than that, we need to ship them if
Try
we
to
can.
fly them. Mhm.
Sometimes we can't. We have to just deliver them and then ship the baby, fly the baby.
To Albuquerque
Yeah, I'll go
Or
and
Lubbock.
do Lubbock.
or Lubbock. Lubbock is popular around here when something tragic happens. That's
Mhm.
why is that? What's preferred in Lubbock than in Albuquerque?
We usually fly to Albuquerque. We have a good connection with their hospitals for our babies, anyways.
Oh, okay.
As for like other people flying out, I don't know. I know they're both good hospitals, like places for hospitals, but
Huh. What is something outside of babies that you guys have seen, experienced, whether you were a part of it or not? Maybe somebody walked in through the ER and you happened to just witness somebody bleeding out, or I don't know, a hand was chopped up. I don't know.
Oh
Give me
my
something.
God.
Give me something.
something extreme.
I try to stay away from all those areas.
What part of the hospital were you? Not well. Let's not answer that. We don't need people going and stalking them.
We are
Yeah,
a locked
we're-
unit.
we're a locked
We're
unit.
locked.
Oh, okay, you're locked
Yeah.
unit. Okay,
Our
so
babies
you're
are like on
That'll
high
stop the
security.
stalker. Sorry.
We're just gonna avoid that question.
Yeah, that's a
I
that's a
said
stalk.
it and immediately
He's
I
trying to
was
stalk.
no.
It's him.
No, I'm just saying because there's so many parts of the hospital.
We're right
We're
by
on the first
ER.
floor.
Oh,
Yeah,
okay. Okay.
Like,
so-
if something
Second floor.
happens-
They're on the second floor.
Yeah. If something happens in the ER that involves a mom, a pregnant lady, or
Uh-huh.
a kid, then we go.
respond to
okay.
like a trauma or
So, probably one of the most popular questions that a lot of people have when it comes to hospitals. Why does it take so dang long sometimes?
well, you have to think if there's a trauma and somebody's dying on the other side of the wall,
Uh-huh.
and it takes every nurse in there, that could take a little while longer. Like if emergencies or different things happen that needs every person to help them to keep somebody alive or to get somebody shipped out, other people have to wait.
And then the nurse doesn't just have one patient. They
Right.
have more. So this person's asking for 3 things. This person needs 4 things. It's a lot.
Why, like, when people go to the hospital, they go in there for a certain reason, and then they start getting, like, sick in the hospital with other stuff, like they just start catching stuff in the hospital. Is that, like, a common thing? I always see it, like, people,
I don't know about that in our, because we have healthy people in our unit, you know.
I just always see it, like, in, like, well, I guess you're in the baby part of it.
Mm,
I always wondered, like, why do people go in there with, like,
Like
The
if you have
worst cold.
surgery and you aren't using the things they give you to use so that your lungs keep expanding, you can get pneumonia.
Oh.
So they'll give you something to blow in, and if you're not using that like you're supposed to, you can get pneumonia because you're not using your lungs.
Your immune system's compromised already, and then there's other people there that are sick too. So I guess that would just up your chance of catching something.
That's what I was wondering. Like,
Well, I mean, you are at a hospital. You got to remind yourself of that. So anytime, you know, you're there, you want to. Because okay, so this is my thing. A buddy of mine today said that he was going to get a flu shot. I haven't got a flu shot in. I don't know. That's how long it's been. It's been forever. What are your takes on that?
You get the flu shot.
Yeah.
Get 'em?
Mhm.
Is it a rumor or is it subjective to certain people that when you get the flu shot, you typically you get sick, you get the flu?
You can have an immune response to the flu shot, but you're not getting the flu.
Okay.
Yeah.
Huh.
And if you end up having the flu, you probably had already caught it,
Prior.
and your symptoms hadn't shown up before.
Ah.
Yeah, it just happened to be around the
I
same time.
haven't got a flu shot since I turned 18, so how long?
Yeah, I don't know. I
We
guess.
don't know how old you are. That's another secret. I'm just kidding.
It keeps.
What, 23?
No,
25.
I'm 23. It's fine.
Wait, you're saying I'm 30?
You
Remember,
said
you're
she's
close
the
to
same.
me.
I am.
I'm 29.
I'm gonna be 29.
Yeah, I'll be
Okay.
24
2 months.
in a month.
But
Yeah, so like 5 years.
yeah,
I'm
I'm
not
old.
old
We're old. Time
I'm
flies.
the oldest one here, so thanks.
You
What's
get it,
what's
man.
time? What is age?
Mhm.
It's
Good job
nothing.
trying to backtrack.
At least be.
I am. I
I'm all
feel.
good. I'm the youngest. I'm just sitting here listening. I really haven't experienced much, so I'm just listening.
Do you or have you ever gotten like? Well, do you get attached to your patients, or is that kind of?
Yeah.
Yeah.
It's not like forbidden, because
No.
I know things happen, unfortunately, and
Yeah.
how does that work?
I think some people make it impact on you
Yeah.
as a
Okay.
nurse,
'Cause we
and
really
you
do.
you make good connections.
Yeah.
Like you helped with a very important part of their life,
Mhm.
so they, also kind of get an attachment to you while they're there.
Because we really, we care about our patients.
Obviously, it stays away,
Right.
it's professional, but
Yeah.
Right.
yeah,
That's right.
Huh.
So, do you like fraternize with your patients?
no.
Like, do you hang out with them or something? Do you just kick it with
No, I know, but I.
Oh, I was like, what do you do?
No,
Like,
Honestly, sometimes you become friends with the
I
moms
was
you
gonna say,
deliver, though.
Yeah, because they want you to see how their baby
Yeah,
is
they'll-
growing.
Oh, okay.
Yeah.
Huh.
They keep you up to date.
I guess if I were in the baby part of it, I think it would be more normal to kind of build some type of relationship. I think if I were elsewhere, like cancer patients or super ill patients along those lines, I think it'd be harder because the risk factor is higher.
Mhm.
Like with, I guess, the death rate, or you know what I mean?
Yeah.
So getting attached,
I don't think I'll be
When-
attached more to like.
You would be attached, but it would take a toll on you.
that's what I mean,
Oh, I
is
guess that's-
seeing
that's
them
what
pass
it's
away time after
Yeah.
time. It's got to be hard on those people, or the doctors or nurses that do attend to those individuals.
Do you think like doctors that go through that they have like PTSD? Like,
Probably.
Probably.
Probably, yeah.
Huh, that's interesting. I never thought about that. I didn't think how.
like I know
really
these
does.
surgeons are like real like mentally ill or something. It's like that's.
I don't know about mentally ill. I think for the most part, probably.
They're crazy though.
No, I think you have to have a certain mindset for that, because you're a doctor and you gotta put, I guess, how would you? I don't know how to phrase something like that.
gotta
You mean well, but at the back of your mind, you know the likelihood that something could go wrong.
Mhm.
So like you bottle your emotions basically and just.
I'm sure they see counselors.
Yeah.
You kind of have to probably.
I mean, I would.
I don't think I would.
So, I want to end on this note. This is something we tend to, it's kind of become a little bit of a segment of ours.
It's a tradition.
Usually those that have children, usually they're young. We like to give you a minute or so, however long you'd like, each one, and give your little ones some advice. So to say they watch this video in 10, 15 years, you know, they see their mamas on YouTube. What is something that you would tell them that you would like them to know, whether it's advice, whether it's just something that you want them to take later on in life? You guys
Right,
can-
Courtney.
I don't know. I guess just don't keep secrets. No matter what you're going through, I've been through it, and I can help you out.
Okay.
So,
Hey, that's the first time we've heard that. I mean,
Secrets to make
honestly.
friends, bro.
Yeah.
Simple as that.
That's true.
my parents were just always really strict, so I kept a lot of things from them, and I just want my kids to be like that. I
Okay.
want them to be able to come to me no matter what. I know that I'm not gonna. There's not gonna be consequences.
Nice.
I would say probably for Troy, just at the age he's at now, seeing how he is.
She's calling one out. That's already
Wasn't
done.
bad, like, Troy, you're gonna do
I'm
it.
gonna call him both out. Like he's a little too nice. Like and
Oh.
he
So
is friends
bad.
with everybody, and some of those kids get him in trouble. So it's okay to not be friends with everybody, and to just remember who you are as a person. For Talia, she just. I don't know. She's like a little sassy spitfire, so
She's not
she.
nice enough.
I think she might be okay going out, but kind of the same thing you said too.
Yeah.
That's good. I like it. I mean,
That's good advice for me for later on in life.
at this point, I think it's almost advice for ourselves.
Yeah,
I think
Let's
that's
see what you have.
yeah,
I'm gonna go
like
through the videos.
every
Uncle Johnny?
yeah,
Respect.
It's
You better
just
start
at
respecting
the
me.
very end of it, we know where to go, we know where to
Uh-huh.
look up, and we will get the best advice. I mean, we're set
I
up to
have
be
the best
great
job in the
dads.
world. I have advice from everybody.
And I mean, our message to kids are listen to your mom and dad. They know better. I know you may not always agree with them, but from experience personally, I should have listened to my parents a lot more often than I did. And
I turned out pretty good with myself.
thankfully, nothing's been too crazy, but I have to admit I was wrong more times than they were wrong. A lot more times, probably every time. So, listen to your moms, they love you. I know that for a fact. On that note, we appreciate you ladies coming on today.
Thank you.
Telling us a lot of stuff maybe we didn't want to hear. But-
and what hospital we got to, in 9 months I can go by?
Eastern. Go to Eastern.
Go to
Not
Easter.
6 to 6.
And
Got
so-
9 months. You already have someone picked out.
I already have 2.
Okay.
I'm going to
Oh my,
back to
he's,
back.
he's gonna have to explain
Imagine if
that.
you have twins.
Oh man.
I'm excited for you to come.
I know, that'll be fun one.
Oh, I'm pretty good.
Well, we thank you. Appreciate it. You guys keep delivering them babies. On that note, hope you guys have a blessed week. You guys, I think this is coming out on Halloween. So,
Spooky season.
Sure.
y'all are watching this. Happy Halloween. Y'all be safe. Till next time, Beard Bros out. Peace. Okay. Alright. I'm all sweating too. Awesome. She can sit with you. If you want, you can have her on. As long as you're okay with having her on camera.
Let's sit over there.
If you want, you can sit on the bench right there. I promise it'll hold you. It holds me.
Go. You have to go over there.
You're shy. All these people are gonna
Yeah,
see you.
we're gonna see you.
Like on
So if
TV.
you don't want anyone to see you, you gotta go over there.
I can put some cartoons on.
You wanna watch cartoons?
No. She's like, no. She's fine.
Go in this corner. Behind me. She's just nervous because you sat right there.
It's okay. I don't know. I don't know how people can react to that. Okay, we'll just get into this.
but we're neglecting the child factor.
No. Oh my goodness. This is the first time we had a kid on set too. So, all right.